Hello, everyone, and welcome to today's webinar, Navigating the New Normal in Business. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You may have joined the presentation, listening using your computer speaker system by default. If you'd prefer to join over the telephone, just select Phone Call in the audio pane of your control panel, and the dial-in information will be displayed. You'll have the opportunity to submit text questions to today's presenters by typing them into the questions pane of the control panel. You may send in your questions at any time during the presentation, and we will collect these and address them during the Q&A session at the end. I would now like to turn it over to the Fidelli Group.
Good afternoon. Thank you everyone for joining. My name is Alex Meckling, and I am the Senior Vice President and Managing Director of the Employee Benefits. The Fidelli Group is excited to be hosting today's webinar in collaboration with our partners at Cerner Corporation. Joining for our discussion today is Dr. David Nill, Vice President and Chief Medical Officer at Cerner Corporation. A physician with Cerner since 2017, Dr. Nill functions as the Global Corporate Medical Director for Cerner and is responsible for more than 40,000 lives around the globe. Dr. Nill brings an acute experience in modern clinical approaches, population health management, and wellness. Dr. Nill is board certified in family medicine and is a member of the American Academy of Family Physicians and the American College of Occupational and Environmental Medicine. In addition, Dr. Nill continues to see clinical patients. Dr. Nill, thank you for joining us today.
All right, thank you for having me. And welcome everyone who's joining the webinar as well.
Thank you. Thank you. Absolutely. So today's discussion will focus on the ongoing pandemic that all of us are very familiar and how it's impacted in each of our lives. And we'll focus on not only the shifts that have taken place in healthcare, but also the significant paradigm shift that we expect to see and that we've already observed in business in general. And to start, we're going to break this down into 4 key areas. First, the current landscape. To set the stage, Dr. Nill is going to walk us through where have we been and where are we today in order to talk about where we go next. Then we'll shift to the business concerns as an employer, as an employee, as a business owner. What are the things that should be keeping us up at night? What are the things that we need to be prepared for in this time of uncertainty? And finally, we'll talk about where do we go next? What is the next step? And then, of course, at the end, we will open up to questions and answers. Okay, so Dr. Nill, the pandemic has unfolded very, very quickly. How did we get to where we are today?
All right, so for everyone online, yes, so the timeline for this, we're well aware, but in January of 2020 is when we started hearing about the cases. And then it took roughly about 10 more days before we heard of the first case in Washington in the United States. Again, very rapidly things moved along. U.S. health emergency was declared February 3rd. Then you saw the federal relief package coming out, and then we saw several of the state lockdowns that began to occur. So Ohio, it happened in, let's see, when was it? May 1st, actually, when that occurred. So when we first started with the pandemic, it took about 100 days to go from 1 case to 1 million cases worldwide. And now that rate of rising by 1 million cases, we're in the single-digit numbers. It's gotten as low as 5 or 6, and we're continuing to hover at that number. So on the next slide, you'll see the global impact of this. And the numbers change daily, fairly drastically daily. But you can see, I mean, this is clearly a global problem. As of this morning, the last I looked, we're about 22,400,000 cases worldwide. And unfortunately, the majority of those are happening in the Americas. So Brazil and the US are kind of leading the pack there. Although India is trying to catch up rapidly. I think they had 65,000 cases yesterday. So continues to be a problem and will continue to be a problem definitely throughout the duration of this year. So with that then, I think we will shift to, oh, go ahead.
Go ahead, Dr. Nill, I apologize.
Well, I was going to say, yeah, then we were going to shift gears to these mitigation and prevention strategies. So obviously, outside of the current mitigation strategy, which is the physical distancing, mask wearing, all of the standard processes, what are we looking at as we continue to progress in this on prevention and treatment of the disease? The gold standard that you want to get to is, of course, vaccination. I'm sure you're following the press closely. There's about 160 manufacturers out there chasing to the finish line to get a vaccine across the line and be one of the ones selected. They're basically trying to compress creation of a novel vaccine that usually takes around 16 years, and we're trying to compress that into an 18-month window. So this has never been done before, but we can see how fast it is moving. You saw the news that Russia's already planning to start some broad administration. Realistically, I'm thinking that we will not likely have a vaccine in the United States until 2021, likely in the second quarter. But again, that's currently pretty much a guess. There are 2 or 3 emerging now that are going into clinical trials. The Oxford vaccine is one of them. And then you've probably already seen the press that the US has advanced purchase 100 million doses to be delivered ideally before 2021. We'll see if that happens, and then 500 million doses after that. The other piece that jumped out in front of us was the race to antibody testing. What I'll say about antibody testing is there still currently isn't evidence to really support its broad-based usage. All the antibody test currently is able to do is tell you if you've developed any kind of an immune response to a potential exposure to the virus. It doesn't say whether you're immune to it, and if we assume immunity, we have no idea how long that immunity will actually last. And as we've already seen, the EEOC has come forward to say that basically employers cannot mandate antibody testing for COVID-19 as a requirement for work capability. So that already stands. Now, as the evidence comes forward, we may see some relaxation or changing of that posture. So that will be a time will tell item as well. And then the third item is drug development for the novel vaccine. I get all kinds of questions on this. Had one today. Does Tamiflu protect against COVID-19? I have not seen any studies out there that says that it actually does. The only drug currently that's under FDA emergency use authorization is remdesivir. It has primarily been reserved for hospitalized patients. There's some additional studies looking at it as far as ambulatory or outpatient people who are at risk, but it doesn't carry that indication as yet. There's some other studies looking at existing drugs, some of the interleukin inhibitors that may show some promise, again, for the more severely ill. And I'd say the only other drug that we've seen that really modifies the course of the disease is Decadron, so steroids. And those are being administered in the hospital. So we've learned a lot about the disease in a short amount of time, and the treatments will continue to emerge.
So, Dr. Nill, thank you for setting that foundation for us and shifting our focus away from where we've been and looking at the way the pandemic has impacted and reshaped business as we know it. At the Fidelity Group, and I'm sure at Cerner as well, when we speak with our employer clients, there are really 4 main areas of concern about the pandemic, their business, and the health of their employees. The first piece of that is testing, which I know we've spoken about a little bit already, but what do we need to know about the available options from a testing perspective? The second is treatment options. Once we have a situation where an individual is acutely impacted, how are we treating that and how are benefit plans going to handle that treatment? The third is care choices. So how are individuals going to be accessing healthcare in a different way, not only surrounding the pandemic, but on a go forward? And then, of course, perhaps the most important part is how do we help employees manage the significant mental health aspect of all of this when we have the uncertainty that we have? So starting with the first piece of this, testing. Dr. Nill, what tests are available and what do we need to know about them?
So I already kind of covered the antibody test. The big test that's out there currently is the diagnostic testing. So there's two variations of it. There's PCR testing, which tests for viral RNA present in the sample, and then there's antigen testing, which is testing for particles of the virus. Antigen testing is more that immediate point of care and hasn't emerged as yet, but we're going to see that really take shape in the coming months. So the current testing for active RNA present is the nasal swab that you've seen. There's some saliva tests. And basically what that test tells you is, do you have virus present at the time the test was done? So if that answers yes and you're showing symptoms, clearly we diagnose you with COVID. If you aren't having symptoms, we're interpreting that as, yes, you have virus, you potentially could spread it, although we don't know that 100%, but we're using it in screening situations to say, this person, we need to have you on the sideline, quarantined for 10 days at least, until we know that if that was active virus, that it has subsided. So it's safe to let you mix with other individuals at this time. Those tests are costing roughly $100 to run at most labs. Again, the antigen testing isn't quite as sensitive as the RNA testing, but it will carry the advantage of 15-minute turnaround times. So, and will come at a cheaper price. So by pricing on it, I'm seeing it's about $23 a test. I would look towards that emerging into the fourth quarter of this year.
And Dr. Nill, something that those of us in Ohio have become very aware of is some of the mixed results that can happen with the testing. As you're aware, our governor very recently had a situation where he was tested positive and then shortly thereafter actually received a negative test result when tested again. Can you talk a little bit about how that sort of thing can happen, and what people should know about the testing and the different results that can occur?
Yeah, so not knowing specifically what type of test he had, it could have been, he was on the tail end of an asymptomatic experience where he did have the virus detected and he cleared it in that amount of time. Any test out there is subject to false positives and false negatives. Given the rush on all these tests that have been developed, some of the rates hadn't fully been, I would say, vetted through the FDA in these emergency use authorizations. So it could have fallen into a false positive. And I'd say the false positive rates are relatively low for most, but that could be a situation. Or again, you could go that they were tested by this method, which has a 97% detection rate, and then they tested with a second test that only has a 85%. So you can see where you could get a false negative situation. So hard to say. And again, the tests are getting more and more validated as we see a lot more cases being seen.
Absolutely.
All right.
So as we look at testing, something that employers really need to be mindful of is how is testing handled from an insurance perspective as we look at our employee benefit program. And so with the passage of the Family First Coronavirus Response Act and then expanded with the CARES Act, testing is now mandated to be covered for both fully insured and self-insured employee benefit plans. But the important thing to keep in mind with that is that the site of the test does have an impact as far as the potential cost exposure to the employer's insurance program. If you were to do testing, for example, an employee goes to a physician, receives an order for a test, goes to a lab, has the test performed, and that would fall under the employer's benefit program. But with the advent, at least in the state of Ohio, of some of the pop-up testing sites where the actual providers are not even requesting insurance information, in that situation, those plans are not actually taking a benefit program, and in fact, those providers are being subsidized by the federal government or the state government in order to deliver those tests in an effort to broaden the testing efforts that are underway. So from an employer's perspective, it's really a matter of understanding what your employees are doing from a test perspective and really having your arms around that. If it is something that is happening in a more of a clinical setting or one of those more pop-up or drive-through, if you will, type of settings. An option that does exist, and there's been a lot of conversation around, is bringing vendors on site for testing. And that is something that we are starting to see more and more frequently as testing does start to become a little bit more reliable. But it is something that, based upon the points that Dr. Nill just shared, that we would encourage employers to really think about as far as any sort of real return to work strategy, because we still aren't 100% sure on all of the implications of certain results of that test. Dr. Nill, would there be anything that you would add to that piece?
No, I mean, we continue to evolve our approach on this. Cerner is covering testing at 100%. We also see it as a price of us doing business because we do have to send travelers to other states now, and testing is required. So we're doing that. If you do choose to use pop-up testing, I would just recommend asking what their sensitivity and specificity rates are. So what's the likelihood of a false positive versus false negative, just so you know, a way to vet your people. And then your consultants, obviously, like Fidelity, can probably help you along those lines to a degree. And then, as we discussed here, the downstream piece, I'll say what Cerner's doing. If you do test positive, the test is covered 100%, but then our treatment and all the other pieces, we follow our standard plan rules as any other illness as you progress.
Absolutely. And we've talked about the testing piece, but of course there's other strategies that many employers are pursuing in order to mitigate the risk of exposure within their workforce as part of bringing people back into the workplace. Dr. Nill, can you talk a little bit about what some of those different strategies are and why they're effective or other considerations that employees need to have if they look at these things?
So we've seen the gamut. We provide some of these ourselves to others, and we do a fair amount of this on our own group. So temperature screenings, we are using that in critical facilities, and you could do that. So if anybody's showing a temperature greater than our setting 9, then that person is excluded from work, needs to get tested and such to make sure that they don't come through. So there's some people that will show up asymptomatic. You will pick up a few of these, but where the key comes in is that you're just not wanting to expose any other of your worksite population. So it's trying to catch them as they come in. One of the strongest on this list is the symptom tracking on the lowest part. So doing a symptom questionnaire before people come in the door is a great idea. So whether you formalize that with an app or something like that, or just ask them, check for these elements. Do you have headache, fever, sore throat, runny nose, all the symptoms we know go with COVID? Those are the two most frequently used elements on the screening side. What we're starting to see a little bit of is testing for the loss of smell. They'll have these smell cards that they use. The thing about it is that roughly it's in the mid 40% of cases will have loss of taste or smell, but it's highly specific. If you have that loss, you probably have COVID, most likely do. But we know that only half of the people. So some people will trickle through. So that's where these combinations of things work. Outside of that, your standard protocols, the physical distancing, social distancing, 6 feet apart, masks on, pretty much all the time now, is your best way to prevent spread within your associates or employee communities. And then understanding your cleaning procedure. So most people are doing their standard cleaning throughout, which is satisfactory, but in high traffic areas, they may clean every couple hours. And then, of course, if you have an exposure or a positive case documented in a work area, then it is recommended to come in and do a very thorough deep cleaning to prevent any exposure to others from surfaces and such where those droplets may have landed. And that's kind of the current state.
So shifting our focus away from just reducing the spread itself, when we do have a situation with an employee or a loved one, whatever the case may be, that does in fact contract COVID and may be, experiencing fairly acute symptoms and has to undergo treatment. Can you walk us through what are the current treatment options that are available and the efficacy of those, and maybe where we're heading from a treatment perspective, or from your perspective?
Yeah, and this is an interesting one because COVID, when it first came out, they treated it as a respiratory disease. And you saw the ventilator treatments and such. And then we saw a rapid movement that this is actually more of an inflammatory disease. It causes clotting problems and other elements. So as a result of that, you've seen the treatment switch. And I mentioned Decadron earlier. So dexamethasone is a steroid. So inpatient treatment, the standard now is people get treated with these steroids. It reduces that inflammatory component, which then reduces the amount of injury to all of the other organs and such. We've seen after people do come out of the hospital that there are a lot of these long-lasting symptoms that may persist in people. The muscle aches, some people can have some heart injury as a result, lung injury, of course, and there can even be neurologic pieces. So that's where that dexamethasone fits on the front end, and that one's very well documented and fits most of the guidelines. I mentioned Resdemivir earlier. So it is an antiviral treatment. It actually targets viral components, and what it's shown is that it does reduce inpatient hospital stay to varying degrees depending on the study, anywhere between 4 to 6 days I've seen in the literature and such. And there is a reduced mortality rate. So survivability is a lot better. They've done studies with, as you've seen, hydroxychloroquine. Most of the studies have said it really doesn't play in the space currently. So the FDA removed that and said that it should not be used in that way currently. And then I mentioned some of the interleukin inhibitors and some of the interleukin 6 inhibitors, again, an anti-inflammatory component. The downside to the interleukin inhibitors is that they can actually reduce your immune response if you have co-infections with anything. So severely sick people, it does present a challenge. Trying to think, I haven't seen any other new ones within the last couple of days. There are several early in trials that they're looking at. They're looking at anything from some of the HIV medications and some of the newer antivirals. But right now, it's primarily Resdemivir is the drug of choice. And then after that, of course, if somebody is ambulatory, so not inpatient, it's usually very much symptom-based treatment. So supportive therapy, have them monitoring their oxygen levels. They have to isolate at home or self-quarantine. And the current requirement is 10 days after symptoms start, fever-free, and symptoms improving. At that point, we're saying that a person has recovered from that. So again, improving in symptoms. So again, at home is very supportive in the current environment. So any other questions on that one?
When we look at the treatment options, much like testing, we of course have the clinical piece, but then from an employer's perspective, how does this fit into their employee benefit program and the impact that it has on their associates? Really, from a treatment perspective, it's different than testing, as you've alluded to, Dr. Nill, previously, which is to say that testing is mandated to be covered at 100%, but that is not the case in all contexts when it comes to treatment. From a fully insured perspective, employers are really at the whim of what the decision that was made by the fully insured health insurance company around treatment. And many of those fully insured carriers have made the decision to, in fact, cover treatment at 100%. That's either because they've made that decision of their own volition or as a result of some sort of mandate from the State Department of Insurance where they're doing business. But when you look at it from a self-insured perspective, the decision is actually with the employer as to whether or not they want to cover the treatment at 100% or treat it as any other illness, which is what you described, Dr. Nill, as the position of Cerner. And that aligns to the position that the Fidelity Group has with our clients. Because we don't currently know to what extent treatment is going to become necessary as it unfolds, what sort of different treatments will emerge, and what the cost exposure of those various treatments will be, we are recommending to our clients that they continue to cover the treatment of the various things that are emerging as they would any other illness under their benefit program. So we're not saying exclude treatment. We're simply saying that you should continue to treat it as you would any other condition that may emerge, because we simply don't know what the overall cost exposure may wind up being. So as we shift away from treatment and recognize that not only has the pandemic caused us to have to really look at COVID itself, it's also started to reshape the way in which we are accessing healthcare for things non-COVID related. So Dr. Nill, can you provide a little context and insight around when it comes to accessing care, what changes are you seeing and what do you think will continue to emerge as we go forward?
Yeah, so if there's anything good that came out of the pandemic, it's the acceleration of the use of telemedicine and virtual care throughout the world, in fact. So, uptake on telemedicine has traditionally been low unless your incentives are designed to really drive it there. But, we shifted overnight to 100% virtual care delivery, at least in the outpatient and ambulatory world. And that is persisting, as we see, and all of the forward-looking benchmarking surveys and such very clearly state that virtual care is here to stay. It has a much bigger role. Our consumers expect it. The convenience is important. The experience is as good as what they expected or better. So as a result of that, we know that going into 2021 with a high predominance of virtual care, and I'll say on our on-site clinics that we run, we're seeing in person the clinics have stayed open in that manner, but roughly 35 to 40% of the visits we're finding we can manage without having in the office, inside the four walls of the clinic interaction. So our providers have had to shift quickly to that model. So as we go forward, knowing that there's going to be a high demand for this, what's your strategy going to be? And there's really two variations of this that I see. There's telemedicine, or the standard, what you think out is telemedicine, video visits and such offering. There's the on-demand. I've got an illness currently. I'm going to dial into this one. It's almost like an Uber model, right? I want to dial in. I may get a different physician each time, but for this issue that I'm having, whether it's pink eye, runny nose, rash, whatever, I'm fine with that. And I'll get that manner of care. And then what we're going to see emerge, and which is a big focus that we have currently, is this virtual primary care. How can you deliver a longitudinal primary care experience to a person, so where I dial in and say, I want my management for my diabetes and such, and I want the same physician every time. And there's been some practices playing with this, but it's now emerged as you really have to be able to deliver this longitudinal care in this manner. And how do you operate in both environments at the same time, of the on-demand, see me for anything, and the virtual primary care? That's going to be where I'd say the next wave of innovation has to happen in this as we move forward. I also characterize, I'll say, telehealth. Video visits is one component of telehealth. There's multiple other elements of it to consider. There's an asynchronous communication through basically e-visits, where I would answer a questionnaire, and then maybe in an hour or two, somebody gets back to me and says, okay, do this next, go pick up your prescription. And still phone medicine. Over the phone is a variation of virtual care in my mind. So that's directionally, we're going to see a lot of movement in this space coming forward over the time. So I think my question back to you then, Alex, is as you see this taking shape, then what are we going to see with payers and networks and items such as that? What's going to happen as the care piece moves forward?
Sure. Absolutely. So Dr. Nill, that's a really important question, and really it's how are employers going to reshape their benefit programs to adapt to the acceleration of change that you've described, and it really comes down to, we believe, 4 fundamental categories. The first is network structure. So what are the providers, the hospitals, the physicians, the various folks that people access care? What does that look like? Are we moving sort of to that old HMO model that a lot of people are familiar with, and various permutations of that? And how does benefit design fit into that and bolster and support those sorts of network structures? The other really crucial piece of this is employee education. To your earlier point, Dr. Nill, one of, I guess, the positive things that has happened with the pandemic is I think there's a renewed attention to reframing how we think about healthcare, and it not just simply being about the treatment of disease, but also looking at health as a general concept, and looking at health status, and how do we educate people around how to use the healthcare system effectively, but also to manage their lives from a health standpoint independent of the healthcare system. And then, of course, as with everything in our society today, how does technology shape that? So from a broad perspective, when we look at it from an insurance perspective or a consulting perspective, really, when we look at the data, we've recognized that the most acutely impacted individuals with COVID tend to be those that are dealing with some sort of chronic disease state. And so really that reinforces the idea that having an engaged primary care relationship with a physician that delivers high quality care, practices evidence-based medicine, is absolutely crucial. We know there's a direct correlation between primary care physician engagement and health status of the individual patient. And so using our benefit programs to help incentivize those types of relationships. So that might be something like sharing your physician network within the network of providers that you are accessing or have as part of your program. Maybe a different copay structure to go to a higher performing physician versus another. That also may mean, starting to consider things like direct primary care, which are, a primary care model where you have a more of a concierge type of an approach to the delivery of care in a more engaged relationship between the physician and the patient. There's also the more extreme side, which is to start narrowing the network and simply saying we are going to make available within our benefit program a subset of the providers that are available to our folks to access, and allowing for a more integrated care model. And then, of course, telemedicine is, as you described, Dr. Nill, really being integrated into that. When we start to shift into employee education, it's a matter of not just creating physical access to care within your benefit program, but getting people engaged in how to think about using care. Like I mentioned, primary care being a great example of just really driving that engagement as a baseline. Encouraging the safeties of healthcare, making sure that people understand that they ultimately are responsible for collaborating with their physician to drive their care. And really not just saying these things, but creating a platform for employees to be able to have access to this information. So something that we've done at the Fidelity Group in collaboration with Cerner is we've built our own health and well-being portal for our own associates, where associates can get information about their individual benefit program. They can participate in health risk assessments and do myriad other things related to educating themselves about health and using the healthcare system. And that's something that we're not only going to use for our own associates, but are intending to bring to market for clients and other employers in the fall of this year. So we think the timing of that is going to be very well positioned with everything that's happening with COVID, because technology will become increasingly important to continue to drive engagement. That technology might be from the insurance market, the large insurers of the world, certainly from organizations like Cerner, but also from other entities that are sure to emerge and reshape healthcare as we go forward. And we simply believe that it's important that employers and the consultants that they work with are keeping them educated on how to use technology to achieve these things. So as we look at the reshaping of healthcare, we know that the backdrop here has really been a matter of not just the business impact or the public health impact, but certainly the mental health impact that uncertainty has created for a lot of individuals. And so it's important that as an employer, we understand that there's more stressors on people today than maybe what we've historically been used to, and different things that we now have to contend with. Obviously, something that's been a hot topic of conversation nationally has been the impact on childcare and schooling and return to school, and how do we continue to evolve business in a way that allows for the flexibility that comes with having a family and having these new types of needs that maybe we're not historically accustomed to dealing with. And so, Dr. Nill, what sort of things from a Cerner perspective are you doing or seeing that are, helping your employee base navigate these very new challenges, probably across the board, I would imagine? Yeah.
As you said, this is adding a lot of stress. Parents are having to work from home and now teach their kids. So we've within Cerner, we've been very flexible again around our work time policies. We've tried to flex around times of day people work, but then looking at other programs, and we're investigating several of these, such as there's I believe it's Bright Horizons is one of them that's out there, where you can go and look and hire teachers or tutors, to check in on your children. So once a week or maybe twice a week, my child would get on a Zoom meeting with this person who would say, okay, have you kept up with your reading and done all that, in order just to take some of the weight off of the parents as they go through the child care issues, with elder care and people getting their preventive screenings. There's some other items that are available out there where there's basically you can be paired with an advocate and such. So we're investigating all of these right now, and these are things to talk closely to your benefits managers about. So do you want to include that in your benefits package or not currently? It's a significant issue. The effects of all of this on the mental health of employees or associates is great. I read an article this weekend that they surveyed teenagers or young adults, and up to 25% of them thought about suicide, which is a frightening number. I mean, I've never seen it that high. So the social disconnectedness is having that effect. So lean hard on your EAP programs. What do they offer? Do they offer manager assistance? Do they offer crisis assistance? What are they doing as far as pointing people to networks or counselors who have, video conferencing or other capabilities to handle the capacity of your workforce? That's a critical piece. Also pushing out just regular training and toolkits to your managers is a technique that we found very useful. Have regular check-ins with your team. Give your managers the guardrails through some of the services available of what they can and can't ask. Basically, how are you doing? And if somebody comes forward, I'm stressed out about this or this, then they know the direction you can refer them to. So like I said, EAP covers the majority of these things because they have financial components, as you see on here. They can help with the counseling, the social interaction, the crisis management elements. We found them very beneficial. And then considering other elements on the work environment, this is one we're delving into now that we've declared that we are not going to return any additional people to the offices until 2021. What about their home work environments? Do we need to consider an adjustment to benefits and such to have them set up a home office in such a way? Because we don't want them all of a sudden showing up into the first part of next year with all kinds of musculoskeletal problems or other issues because they didn't have the right support for their remote work environment. And so those are all the things that we're considering at this time without really getting into super specifics on, which vendors and such, but items that I would guide people to think through as they plan for at least the next 18 months, because the lasting impact of COVID is going to definitely go to the end of 2021 and probably into 2022. And I touched on that. So that's another area. I was going to say the vendor selection piece. That's a hard one for me to provide good guidance for.
Sure. And so something that, from a consulting perspective, when we work with employer clients, obviously there's a lot of different information that is out there, not just about the pandemic, but about mental health in general, and a lot of different resources. And so it's important, we believe, to not only make that information readily available for associates, but to streamline the delivery so that people can get the information they need when they need it. And there's a couple of different approaches that we found to be effective. One is a very simple approach, which is to put together a intranet or a suppository of information about the local and state government organizations or community-based programs that are out there for outreach that people can use should they be struggling with some sort of mental health issue or event happening to a loved one. The other thing is, as you mentioned, Dr. Nill, is an EAP program, an employee assistance program. These are things that not all employers today are offering, but we think it's something that absolutely needs to be a best practice for all employers, not only because of the pandemic, but just with the focus and the shift that we have from a healthcare perspective on the importance of mental health in general and the impact that has on a variety of personal things that people deal with from a physical health perspective, but also from a business perspective as well. So having a robust EAP program that does fit the needs of your particular population and demographics is really essential. And that is something that we actively work with our clients on and would encourage you and the advisors that you engage with to do the same. And then making sure that the information you're getting to employees is meaningful to them. So welcoming employee feedback. One thing we've done internally at the Fidelity Group is always to solicit that feedback from our associates, because we don't want to make the mistake of thinking that we're delivering something to employees that they're in need of, only to find that it isn't exactly meeting the needs that they actually have for themselves. So creating that open dialogue, we think, is very effective, and it shows an investment on the part of the employer in the well-being of the employee. So we've talked about a lot of different information, and really the ultimate question is, where do we go from here? And I think some of the key takeaways, first and foremost, is that we don't know what the future is going to hold. Myself and Dr. Nill, we don't have a crystal ball. But what we do know are that there are some areas that we can prepare for, so that as the uncertainty of the future does become more clear, we're in the best position we can be in to meet the potential challenges that may emerge and adapt to that new normal. And so what that really looks like, first and foremost, is take a look at your total benefits package. Now is a very good time to start thinking about, are there gaps in different parts of your program that you're offering? So for example, today, as an individual, people are thinking much more potentially about their finances, the loss of income that has happened from the shutdown of the economy in certain areas. So things like disability benefits and other financial protection programs, life insurance, supplemental life insurance, services to offset the cost of out-of-pocket expenses under your medical benefit, critical illness programs. Those things are becoming more valuable and important to individual employees today. And so having a strategy to fit a program like that into your benefit package, or even look at the programs you're offering already to make sure that they align to the needs of your associates. Making sure that you are also, and this is something that's been a point of emphasis for a long time, but has taken on a different meaning today, is reviewing your pharmacy benefit manager, your PBM contracts. When we know that COVID disproportionately impacts adversely those that are dealing with chronic disease states that are often treated by specialty medications, we want to make sure that your PBM partner has the appropriate clinical programs in place to help that person manage the use of that prescription drug product effectively, and that the unit cost is competitive as well, because that not only translates into savings for you as an organization, but also that individual as well, which leads to better drug compliance. We also want to make sure that your PBM contracts are beginning to contemplate the potential for emerging treatments that may be stemming from the pandemic itself. So we think these are some of the key areas to look at. When we talk about your benefit program too, I think, again, the important piece of emphasis is that it doesn't just have to be an insurance product. It can also be things like dependent care FSAs to help with child care needs, EAP programs, and so on. So this is a really good time to sit down with your benefit advisor, be it within the Fidelity Group or elsewhere, and have these discussions about how is the pandemic reshaping your views of what your benefit program means to your associates, and what strategies do you have to make sure that you are preparing for the future, so that not only are you adapting to the new normal, but that you're going to continue to have an employee base that finds value in something that you're investing in. Dr. Nill, is there anything that you would add?
No, I agree with everything you said there, because that was one of my big questions is, my wife, she runs a small business, right? And I'm in the space to a degree, but if she was out there on her own, what could she do to figure out, okay, how do I manage benefits, especially in this time, or where can I get advice and service to really make sure that I'm supporting my employees during this challenging time? So, and you covered several aspects of that, but if there's any additional thoughts there.
Yeah, absolutely. I think and this would be true whether it's a small business or a large organization, like Cerner. I think it starts with making sure that you have a strategy for every piece and part of your benefit package. And this is true pre-pandemic in the world as it was post-pandemic. All of these things within an insurance benefit program layer on top of each other, and I think it's very important that employers have a comprehensive strategy and look at things holistically. As I mentioned, making sure that you look at not only your medical plan and the deductibles and out-of-pocket maximums, but how does telemedicine fit into the types of behaviors you want to incentivize with your plan design? Do you drive primary care physician engagement appropriately with your plan design? How is all of that functioning together? Another area of emphasis too is, again, the wellness piece, the population health piece. Whether you're a large employer or a small employer, the health and well-being of your associates has a direct impact on your business continuity and employee performance. And so it is an investment that we believe is worthwhile for organizations. We understand that certainly today, especially, budgets may be differently than what they've been in the past. And so an ability to make a large investment in a wellness program may be difficult right now. But we do think there are steps that can be taken very low cost to start to go into that frame of mind and help shift the culture from healthcare being about disease treatment and really being about a more holistic approach to health status. And so again, it comes down to having that strategic conversation with your advisor and making sure that on an annual basis, there is that discussion around what is our game plan and how do we build our program to meet the objectives that we set. So, Dr. Nill, a question that I would have for you, we talked a little bit about vaccinations. And you mentioned that obviously the timeline for development is being truncated fairly substantially. Should individuals be concerned about the truncated timeline as far as the safety of vaccines that might be emerging?
Yeah, I mean, that's a great question. And we've actually seen it in the data on people queried about their willingness to get a COVID vaccine. It's very clearly showing that there is hesitation there, and it is understandable with this reduced timeline. From what I've seen in the early vaccine trials is that, yeah, as any other vaccine, they do have those immediate side effects that you could expect, whether it's fever or, injection site tenderness and such. The FDA is being, I would say, judicious in how they're looking at this. So I think at least short-term vaccine safety, we can feel pretty good about our trials process and such. The only question mark that lingers in my mind is some of those longer-term or later effects of the vaccine. And unfortunately, we'll have to wait a while to understand that. But that's part of the phase 3 trials that's going on to try to flush that out. So I'd say overall, I have faith in our process and how we do this. Honestly, would I be the very first person to stand up and get the vaccine? Maybe not. But the phase 3 trials, they're recruiting 30,000 people in some of these. So we should have pretty good data by the time they're ready to do wide disbursement of the vaccine. And again, I think if that comes in mid next year, we should be in a good place to understand what those potential adverse effects look like.
And Cody, do we have any other questions that have been submitted?
Hello, and thank you for confirming. We are still waiting for more questions from the audience at this time, but we do have a few more queued up for Dr. Nill that I can read off at the moment.
Okay.
The first is, do we expect COVID-19 to be a seasonal occurrence?
Well, I'd say based upon what we've seen so far, there was no lull in the summertime. So this just appears to be what I would describe as a slow burn type of approach that we, does it have seasonality to it? I don't think so based upon, the traditional seasonal effects that you would see. I think the thing that will drive seasonality to it is the fact that we're trying to get schools back in session, and many of them have canceled, but many are not. I think as people start relaxing that physical distancing, that will manifest. It will look like seasonal, but it may not be seasonal. So quick answer is doesn't appear to be seasonal based upon weather and such, but more on personal habits.
Great, thank you. And the next question we had come in is, how will COVID impact insurance renewals and pricing?
So Cody, I'll take that one. This is Alex. So when we look at the way that COVID has unfolded, one of the interesting things has been that there was obviously a shutdown of life basically, and so with that came a time period where elective medical services were not taking place. Only care for emergencies or very, very acute situations or COVID-related situations were taking place through a period of months. So that what that's done is that has compressed somewhat artificially the utilization and claim expenditures that the insurance markets are seeing overall for a period of time. And so what we don't know right now is how much of that elective utilization may take place and when. And so for that reason, because we on the phone don't know, that means that the insurance companies don't know either. And so insurers are historically fairly conservative. And so what we do anticipate is that in order to offset the potential inundation of these claims hitting all at once, or potentially being exacerbated by the fact that they did not take an extended period of time, that there will be some level of reserving and hedging that will take place, and that we'll see that reflected in insurance renewal pricing. We do not know right now to what extent an impact that will have, but we know it's coming, and we are actively engaging with the health insurance markets to have that discussion and prepare for the renewals that will be issued over the coming year, and making sure that we have our arms around that and are communicating that with our employer clients.
Great, thank you so much. The next question we have coming in is, our audience member says, I own a small business. What more can I be doing as an employer to make my benefit program more purposeful for my employees?
So this gets to, it's a great question, and it really gets to something that Dr. Nill had asked kind of at the onset of the Q&A, which is, really making sure that all of these various topics that we've discussed today are part of your strategic conversations as we go forward. Looking at how is your network strategy tied to your benefit design? How are supplemental benefits and voluntary benefits being used as part of a holistic approach to the way your program's constructed? But even moving outside of the insurance piece, how is population health and wellness something that is being integrated into your program through employee education, the use of technology to engage your employees, and really just shifting that culture and that perspective around healthcare. We do have a moment in time right now with the attention that has been paid to COVID, and the reality of the people that are most impacted tend to have a poor health status. So there's a moment of opportunity here to shift that narrative. And I think it's incumbent upon us at the Fidelity Group as consultants, but also employers offering healthcare programs to try to seize that moment and engage people, because I think now is an opportune time to do so.
Excellent, thank you. And we do have another question coming in. My apologies, go ahead.
Go ahead, Cody. I was just going to ask if we had more questions.
Yes. In that case, yes. We do have one. Our guest is asking, how will we distinguish common flu and COVID-19 coronavirus? Both seem to have more deadly effect on elder populations.
Yeah, that another great question, and a topic I've probably discussed daily every week now. So the symptoms do overlap considerably. What we're seeing most clinicians as individuals come in for these, they're testing them for all three actually as they come through, because even though we haven't seen much flu lately, we know that you could have the flu and COVID at the same time. So from the provider community, some of them are starting and just doing strep and flu first because they can get immediate response or results on those. And if one of those show positive, they'll generally treat for those and maybe not do the COVID test. I'd say most of our workforce clinics that we run and what we do for ourselves, we actually just go ahead and test for all three, knowing that the COVID test is going to take anywhere from 24 to 48 hours to come back. Not that it's going to change treatment plan much, but just to know in case, you know, there are challenges, and especially in those higher risk individuals that you identify. You know, we try to follow up with them regularly, so the clinician community will follow up with those higher risk folks to say, how are you doing? Regular check-ins are important.
Great, thank you so much, Dr. Nill. I believe that is all the questions that we have at this time.
Okay. Well, on behalf of the Fidelity Group and Cerner Corporation, I want to thank everybody for making the time to join us today. Hopefully this was informative and insightful. Dr. Nill, thank you very much for spending time with us here this afternoon. Obviously, your perspective and that of Cerner's is extremely valuable, and your thought leadership is much appreciated. For those on the call today, be on the lookout for an email with today's presentation included. And if you have any further questions, please feel free to reach out to us. We want to continue to be a source of insight and information for you and your associates as we go forward. Thank you very much.
All right, thank you for having me.